So today I'm going to explain you about anemia. Well, some still cracking their head about what is anemia. Anemia, when there is hemoglobin concentration or red blood cell count less than the normal range. These are the normal range for both men and women for hemoglobin concentration and also red blood cell count. Now we are going to see about the causes of anemia. First of all, decreased red blood cell production. Whenever we comes to red blood cell production, we need to figure out that where the red blood cells are produced. Yes, bone marrow. Whenever there is a disease in the bone marrow, we also known as aplastic anemia. It also affects the red blood cell production. Next, chronic kidney disease. As we know, kidney is the vital organ to produce erythropoietin, and erythropoietin is a hormone that stimulates the bone marrow for more red blood cell production. But whenever there is lacking of erythropoietin, it will also affect the decreased red blood cell production. Besides, also the chronic inflammatory disease that affect the red blood cell production. Next causes of anemia is blood loss. Blood loss due to GIT blood loss such as stomach ulcer and hemorrhoids, and other blood loss due to heavy menstruation for those women. Lastly, the causes of anemia increase red blood cell destruction. Whenever there is a destruction, we will refer to hemolysis. This hemolysis is due to maybe there is a autoimmune disease, or there will be morphological changes of red blood cell such as in sickle cell anemia or in G6PD. There will be some morphological changes in the red blood cell. So this will cause the increased destruction in the spleen or in the blood vessels. Other causes of anemia are such as inherited disease such as thalassemia, and also increased red blood cell demand for those during pregnancy or lactation.
Anemia pathophysiology varies widely depending on the underlying etiology. Anemia is caused by an imbalance in red blood cell production to elimination or destruction. Anemia results from the effect of reduced oxygen transport to tissue, which may affect various organ systems. The main mechanism involved in anemia is blood loss, hemolytic anemia, and differential erythropoiesis. The causes of blood loss can be classified as acute or chronic. Acute anemia is due to hemorrhage surgery, trauma, or menorrhagia. Chronic is due to heavy menstrual bleeding and prolonged gastrointestinal blood losses. Hemolytic anemia can be caused by acquired and also hereditary. Acquired is due to immune-mediated infection, microangiopathic blood transfusion related, and secondary to hyperplanism. Hereditary is caused by hemoglobin abnormalities, red blood cell metabolic defects such as GCPD deficiency, and red blood cell membrane synthesis deficiency such as hereditary spherocytosis and erythrocytosis. Deficient erythropoiesis is due to microcytic, normocytic, and normochromic and macrocytic. Anemia is about someone who has a hemoglobin level of fewer than 12 grams per deciliter. This could be caused by one of three different situations. It could be decreased production of red blood cell, increased destruction of red blood cell, and acute blood loss. Decreased red blood cell production is due to iron deficiency who are not taking enough iron in their diet, or malabsorption syndrome, where the patient may not absorb the iron even though they are taking it in their diet. Folic acid and B12 deficiency is the patient not getting enough this nutrition in their diet. This nutrition defect can happen in people who are strict vegetarians, who undergo gastric surgery, and not enough absorption occurs in patients who are alcoholic and have malabsorption syndrome. Decreased erythropoietin production is due to renal failure and bone marrow diseases. Increased destruction of red blood cell is due to hemolytic anemia, sickle cell diseases, which going to develop anemia as a result of having some of those red blood cells in sickle shape will then be destroyed by the body because they are not functioning as normal red blood cell and they ended up blocking the bloodstream circulation. Autoimmune diseases, splenic disorder, and damage during dialysis, which running blood out of the body, bypass, and intra-aortic balloon pump therapy.
Hi, I'm Ilesha. So today I'm going to talk about the sign and symptoms of general anemia. First and obvious symptoms are pale skin, lips and palm. This paleness is because of an abnormal loss of color from normal skin or mucous membranes. Next is shortness of breath, also known as dyspnea, and also increase in heart rate. Without enough iron, your body can't produce enough of a substance in red blood cells that enables them to carry oxygen in a form of hemoglobin. As a result, iron deficiency anemia may leave you tired and feeling shortness of breath. Following to that, fatigue, lethargic and feeling tired due to less of oxygen transport to the body and tissues. Finally, poor concentration throughout the day and having a headache are also symptoms of anemia. Next, we are going to talk about the investigation to diagnose anemia. Firstly, complete blood count test. The results from it shows low hematocrit, hemoglobin and red blood cell count. The white blood cell and platelet count remain normal. It did not affect the anemia. Next is the peripheral blood smear. It shows nomocytic, which is the red blood cell in normal shape, and nomochromic, which is the red blood cell in normal color.
Hi everyone, today I'm going to talk about the treatment and management for anemia. So anemia can be treated by using several methods. Okay, firstly is by medicating the patient with anemia. Anemia will be caused by autoimmune disease. So medicine is used to suppress the immune system. There are several medications such as ferrous sulfate, inhibitor ferrum and also folic acid, which are given to patients with anemia. Next is the blood transfusion. So when a patient lost a lot of blood, so it can result in very poor oxygen transport and this may lead to multiple organ failures. So by doing blood transfusion, it will help to increase the blood in our body and also the oxygen level will be increased. So in order to do blood transfusion, our HB, which is the hemoglobin level, should be below 7. Okay, next is by dietary supplement. But by giving dietary supplement to patients with anemia, it can reduce the symptoms and also sometimes cure anemia. So this is done for people with mild or moderate anemia. It doesn't work with people with severe anemia. So basically what are the supplements which are given will be the iron supplement. This is to increase the iron intake in the body. And also vitamin B12, which is used to treat vitamin B12 deficiency anemia, and also folate. Okay, next is by doing surgery. Okay, we also need to treat the underlying causes of anemia, which sometimes could be the damage to our kidney, which produces the red blood cells. So sometimes surgeon will perform surgery to remove the kidney which are damaged. So this can also treat anemia. And also bone marrow transplant. So bone marrow transplant is also known as hematopoietic stem cell transplant. So this will change the faulty red blood cell with a new healthy stem cell. And the autogenic transplant is the transplant within our body, and there is also the allogenic transplant, which is involving another donor. So that's all. Thank you.
You